Everyone ready to go? Yeah? Okay. All right. Sounds good. Well, welcome everyone. We are all so excited that you're all here today, and we're so excited to be able to hear from our speakers. Before we dive into the session, I just wanted to go over a background of the Idaho Scam Jam Alliance, and then a background of our speakers today as well, and a few ground rules. And I'm Bethany. I'm with AARP Idaho. So just a quick background of the Idaho Scam Jam Alliance. We are a broad-based coalition of nonprofit organizations and state agencies. We educate and arm the public with the tools they need to recognize and stay protected from fraud and identity theft. And we really like to think about fraud as it isn't a question of if, it's a question of when you're targeted for fraud. We all tend to think we are invincible. The statistics prove that scammers are successful, and they show otherwise. And so really a huge point of these sessions is to not let this happen to you, your family member, or your neighbor. So just a few ground rules before we start the session. Participants can leave the class at any time. It's not a requirement for you to have your camera on for the session, but you can have it on if you want, so whatever you're most comfortable with. Everyone's microphones will be muted. If you have any questions, please feel free to ask them in the chat. We'll be monitoring the chat the whole time. And if you're not super familiar with Zoom or chat, it should be at the bottom of your screen. If you move your mouse or cursor to the bottom, you'll see a little chat logo, and that is where that chat box will pop up. So if you just click on it, and please stick to professional language or behavior only during the class. And finally, the session will be recorded. So if you wish to not be recorded, just go ahead and turn your camera off, or if you're all right, you can leave it on or turn it off, whatever works for you. And then a little bit about one of our speakers today. Admir Selimovic is a program specialist for the Idaho Commission on Aging and oversees 3 programs for the state: the Senior Community Service Employment Program, the Senior Medicare Patrol, and the Medicare Improvements for Patients and Providers Act. Admir assists in providing technical assistance and oversight to SMP and MIPPA staff across the state who work tirelessly to ensure that Medicare beneficiaries are empowered with education on how to prevent, detect, and report Medicare fraud. So again, welcome. We are all so excited that you're here. And we did also want to, before we fully dive into the session, we wanted to see where everyone is from today. So if you would like to, if you know how to use the reaction button, if you're from North Idaho, if you want to go ahead and put a reaction up just so we can see generally who we're reaching, that would be great. And then if you're from more of the Boise, Idaho area, you can go ahead and put a reaction up as well. Thank you. And yeah, we will go ahead and get started. So I'll hand it over to our speakers.
Perfect. Thank you so much, Bethany, and thank you for that introduction. Welcome, everyone. I appreciate all of you for tuning in. I hope you guys can hear me well, and I hope that you guys are seeing my screen well. Thanks so much for tuning into the Lunch and Learn event. As Bethany said, my name is Admir Selimovic, and I work for the Idaho Commission on Aging as one of many program specialists with ICOA. Today, what I really wanted to go over is really the current trends and status of COVID-19 frauds and scams that are happening across the country. For those that might not be as up to date on COVID-19 scams or frauds, the US has seen a pretty big increase in the amount of fake COVID-19 treatments and miracle cures, door-to-door scammers, trying to sell products and trying to sell fake services that are going to treat their COVID diagnoses. And then there's also been an increase in robocalls asking for personal information, getting folks to give out Medicare numbers, Social Security numbers, and other financial information so that they can get COVID-19 resources. The SMP has been working diligently at both the local and the national level to ensure that Medicare beneficiaries, families, and caregivers are all empowered with the knowledge in order to prevent these situations from happening. One of my co-presenters, Brad Talbot, will also be going more into depth on what to look for when looking at Medicare Summary notices, and also the explanation of benefits that you receive in emails, or excuse me, in mails, and making sure that you guys are examining those and ensuring that you're, up to date on what you should be looking for as far as any type of, fraudulent activity on those. So we'll get started. So what I'll just be going today over, just as this is an agenda, just going into briefly about what the Senior Medicare Patrol does and who we are, including, some highlights about some accomplishments that the SMP team across the state has achieved this previous year. And then we'll also go into COVID-19 frauds and scams, again, that have been happening both across the country. We haven't seen as much of them happening here in the state of Idaho as some other states, which is, I'd want to say, an action of us being diligent and sending out preventative information and being active in our communities. Then Brad Talbot is going to be going more into depth on what to look for when you're examining your Medicare Summary notices and explanation of benefits, and other ways that you can prevent healthcare fraud, errors, and abuse. So a little bit about the Senior Medicare Patrol. The Senior Medicare Patrol is a group that empowers and assists Medicare beneficiaries, their families, caregivers, in order to prevent, detect, and report healthcare fraud, errors, and abuse. And the primary ways that we do this is through outreach, counseling, and education. In the state of Idaho, there's 6 SMP volunteer coordinators located in 6 different planning and service areas across the state. Each 6 of the SMP volunteer coordinators, and in each of those 6 planning and service areas also has SMP volunteers that go out into the community and give presentations to groups. They do exhibits at events, and they work one-on-one with Medicare beneficiaries. And they go through an array of different topics as far as identifying fraud and abuse, what to look for, how to read Medicare Summary notices, explanation of benefits, and things, basic things that people might miss, like, not answering robocalls and identifying folks that, are door-to-door scammers, and what to look for as far as red flags. We really do work closely with entities where we make appropriate referrals. So we get a client, they'll go through a process with our SMP volunteer coordinators. And then if we need to take it a step further, we'll make appropriate referrals to the Office of the Inspector General. We'll also make referrals to the 1-800 Medicare hotline for further information. And then we also work really closely with the Center for Medicare and Medicaid Services as well. So 2019, by SMP by the numbers, again, I for the SMP volunteer coordinators or any SMP volunteers and staff that are on this webinar today, I really appreciate everything that you guys do and the work that you guys do out in the community. For those that might not be, well aware of just the SMP team and what they have to do, they really have to go out into the community and talk with folks. And with COVID-19 happening, it's been a challenge, as it has been with, for everything in our lives as of recent. So they've been working really hard these past several months to try to meet one-on-one with clients through things like Skype, FaceTime, any type of technological tool that they can use to stay in contact with clients and different groups out there, they've been doing. Some of these numbers, as you can tell, just outlines the total active team members that we have. And this is across the nation, actually. And then this is also the number of group and outreach and education events that we've done nationally. It also outlines the number of individual interactions. So basically when we're going out and meeting with clients one-on-one. The number of people reached, this also includes, both the amount of clients that we go out to see, and then also the amount that is reached through things like direct mailing campaigns, television ads, radio ads, social media posts, and things of that nature. For things where you're looking at this, where it says expected Medicare recoveries in the amount of 2.4 million, this amount actually represents both the actual and expected Medicare recoveries from criminal actions, settlements, civil judgments, or overpayments that resulted from these referrals going to another entity. This measure applies to the amount of money that was ordered or agreed upon to be returned to Medicare and may not reflect the actual collections. And so this is Idaho SMP by the numbers, essentially those same statistics that you saw nationally in the previous slide. This is reflective of the Idaho SMP team. So we have 95 active SMP team members in the previous year that have conducted a total of 404 group outreach and educational events. The number of individual interactions that we did was 5,354, and the number of people reached was over 17,000. And as you can tell, we've also managed to avoid, do that cost avoidance part on behalf of the Medicare, Medicaid beneficiaries. So, those are all great stats. The more outreach and the more group educations that we do in the future is better, because as we're going to get into it, COVID-19 is rampant and we don't know when it's going to stop. So COVID-19 fraud, and what is it? So generally speaking, when we say the word fraud, fraud is just a broad definition for criminal deception intended to result in financial or personal gain. This is typically something that is intentional in nature and is usually premeditated. So someone's actively going out to steal money from you. Especially in the cases of COVID-19 fraud, we've been seeing, increases of it happening in the country. As you guys can tell by the graphic, COVID-19 fraud comes in all different shapes and sizes, and different people trying to scam you through different methods, and we'll get into that as we go through these slides. So COVID-19 fraud regarding medical care. So there are some things regarding medical care, of course, where scammers come and they try to do fraudulent activities on behalf of your medical care. One of them is billing issues. Billing issues related to COVID-19 medical care can be complicated. The typical issues that have been received through the SMP network includes things like overcharging for services not rendered, misrepresentation of services. So saying you're actually treating one condition and then you're billing for a completely different condition. Looking at things like billing for services, again, not rendered has been one of the primary ones that has been active, not just in the state of Idaho, but also across, nationally. And many different states have reported to the SMP network that this is probably one of the primary ways that COVID-19 scammers are trying to get people's money. Another complicated issue is really misdiagnosing a patient. You guys might have heard this in the news, where a person passes away from COVID-19 related symptoms, but had a different set of conditions or symptoms prior to them passing away, and then giving them the cause of death to be COVID-19 symptoms. This has been a rather gray area, and in-depth instruction from national entities to the local level has not really been provided. The best word of advice that we can give is to report this concern to SMP if you feel that any foul play is suspected. Another issue that has been occurring in other states, probably not to the degree that we see with the misdiagnosing and the billing issues, is issues with medical transportation. No major reports have been made of issues regarding medical transportation. As some of you know, and maybe have done your research, the Center for Medicare and Medicaid, or CMS, is allowing limited waivers for medical transportation. So make sure that beneficiaries, caregivers, and SMPs are reviewing, people's billing for emergency transportation for things like routine grocery shopping or pharmacy transportation, or anything or medical transportation that isn't necessarily received. So just keep on lookout for that if you're working with anyone that's receiving any type of those services, or if you're receiving any of those services. So miracle cures. Everyone's always wondering when the cure for COVID-19 is going to come out. Are there cures? The only reports that we get is that there's medical and pharmaceutical laboratories out there that are currently en route to give us a COVID-19 cure, and we hope that it's going to come sooner rather than later. As of right now, there really are no cures for COVID-19. People are treating the symptoms, with things like trouble breathing, with fevers, with headaches, and pretty much anything that is COVID-19 related, they're treating the symptoms. There has been promising advancements in medications and treatments for COVID-19, but none that are FDA approved. So anyone that's knocking on your door, anyone that's making calls to you and saying we have a COVID-19 cure that's going to treat you, that's going to make all your symptoms go away, is just not true. So, use that. If you hear the word COVID-19 and we have a cure or anything related, it's not true as of right now. We hope that's going to change here in the near future. Emergency use authorization has been issued by the FDA for some treatments. I believe as of right now, the main drug of choice is remdesivir. And that's really an antiviral that's aimed at stopping the spread of the virus throughout the body. Again, it's not necessarily the cure for COVID-19. One word of caution that I would say is for, again, whoever is trying to pitch something to you about a COVID-19 cure, just ignore it. Say you're not interested. If someone even in a white coat with credentials comes up to you and says there's a COVID-19 cure, I would use your best judgment. You listen to your gut instinct and don't believe those individuals. Go to your doctor, go to your primary care physicians, the people that you trust and that handle your medical care. Those are the people that you should be listening to. There's even some alternative treatments. So aside from the cure, people are giving things like essential oils, teas, tinctures. In some states where medical marijuana is legal, they're saying, they have a specific type of medical marijuana that's COVID-19 that specifically targets, the COVID-19 strain. Again, none of this has been approved by the FDA. As always, consult your physician. Use that as your rule of thumb for any type of COVID-19 cure or treatment that you plan on undergoing. So as far as COVID-19 vaccines, again, as mentioned, there is no COVID-19 vaccine as of right now. It's currently in progress as we hear from our U.S. government. I'm sure all of us are, sticking and staying glued to our TVs, trying to hear, the stats for COVID-19, new COVID-19 cases, new COVID-19 deaths, and more specifically, the new COVID-19 cure. There's been a lot of discussion on when this will come out. Nobody knows yet. Again, the government's hoping in the next few months. It could even be until spring or summer, might be longer. Again, it's still in the developmental stages, and we hope to hear, better news as time goes along. Current scams regarding COVID-19 vaccines, again, include things like robocalls, telemarketing, emails, online advertisements, and door-to-door sales. Like many medical procedures and treatments, your doctor will more than likely know, what to prescribe you and to, what vaccine is going to come out into the future. They're staying tuned just as much as you are, and they probably have a more robust network of colleagues and organizations that they're a part of, and they can give you that information a lot better than someone coming and doing door-to-door sales can. So again, use your best judgment, listen to your gut instinct. Don't believe people that knock on your door saying they have a COVID-19 cure. Another big sort of scam that's been happening across the country is the influx of the N95 Mask Scam and other personal protective equipment. So as you all know, when we're walking out in grocery stores, when we're going to any public places, it's a best practice to put on masks. And you see different types of people put on different types of masks. Some people put on those face shields, some people put cloth masks, some people put on surgical masks. So a lot of people, that you'll probably encounter in stores or in public places are using surgical masks. Others, primarily you might use cloth masks. But one thing is the N95 scam. So when we're looking at the image that you guys see on the slides, the N95 mask was really intended as a laboratory and medical grade equipment. N95 just refers to that mask is intended to protect from 95% of outside particles. So it's really intended for frontline medical care workers that are working with COVID-19 patients and that are actually working in laboratories. Unfortunately, scammers out there are selling these N95 masks, which is, as you might guess, are a lot more expensive than regular surgical masks or cloth masks. They're going out door to door and they're opening up online sort of retail shops, and they're advertising basic surgical masks as N95 masks and selling it for the price of an N95 mask. Then what happens? People that don't know the difference, they'll buy those, they'll think they're better protected, they'll pay a lot of money for these masks, and then they don't get the product that they purchased. Again, really be wary of, what personal protective equipment you're buying, and making sure that it is FDA approved. If surgical masks have been working great in preventing, COVID-19 from spreading. But really be careful if you are going to buy something that says N95 on it. Make sure that you do your research and that you are actually buying proper N95 mask rather than some knockoff product or something cheap that has nothing even to do with the materials that are in an N95 mask. A lot of individuals have also been purchasing and using FDA approved, different types of personal protective equipment. Again, be really wary of door-to-door sales for personal protective equipment. Scammers just have a tendency to, put fake materials or fake different components in some of this personal protective equipment. Again, like masks and like hand sanitizers, again, is another big one. They'll use fake ingredients that are very cheap and sell it for very, very high prices. Really do your research. If you're unsure, make sure that you are buying your products from approved and quality retailers. For things like hand sanitizers, if someone, again, is doing door-to-door sales or opening up, pop-up tents and selling you a special grade of hand sanitizer for an enormous amount of money, and you're questioning it, again, believe your gut instinct. You can all buy your hand sanitizers and other personal protective equipment from well-known retailers, places like Walmart, Target, Albertsons. Any of these grocery shops that carry hand sanitizers will work just fine for those of you that do need hand sanitizers. There was actually one situation where individuals, I should say multiple reports of individuals buying these very expensive hand sanitizers that are, that these scammers are selling as better than store-bought hand sanitizers, and they're having, really harmful complications because they're containing chemicals and other, diluted mixtures in these bottles. People are using them. They don't do their research beforehand, and then it actually ends up being more harmful than helpful at the end. So, with any of this stuff, do your research. Make sure, you're asking questions and making sure that you are buying this stuff from, proper sources. So telehealth is another big one, with the increased amount of folks that have been receiving COVID-19 diagnosis, and also, with the entire health system across the country just being bombarded, there's been a huge shift to everything moving telehealth. You'll see, a lot more, and I'm sure, some of you that are on this phone call, have either, done a telehealth assessment with one of your primary care physicians, or know someone that is now doing telehealth appointments with their primary care physician rather than actually going to a clinic. So one way scammers really sort of manipulate this system is by misrepresenting who they are over a telehealth session. So they'll send out mail, they'll send out emails, they'll get in contact with folks trying to set up appointments as a nurse, or they'll try to represent themselves as some sort of medical assistant or someone with robust medical knowledge. And then they'll actually misrepresent their credentials. People believe them, and then once they're in, this can lead to beneficiaries believing these providers, and then they'll give their Medicare numbers, they'll give their Social Security numbers and other financial information. One big thing is, for folks that are scammed, they'll ask for cash, or they'll ask for wires right on the spot. Again, that's another big red flag. Again, what we saw in the previous slides is scamming for and billing for services not rendered. They're going to go ahead and bill, Medicare beneficiaries for services not rendered, and then they're going to, charge them exorbitant amounts of money. And then they'll give them things like unnecessary testing or even other treatments. Again, there's not cures out there, so they'll give them, bogus types of treatments and then bill them for those. It's also a red flag for any, provider providing telehealth services to offer unsolicited telehealth offers, offering things like, we have pain creams, we have braces, we can even do genetic testing for you. If they start going off topic and are giving you services or mentioning different products that have nothing to do with, perhaps with why you contacted them, that again is a very, very big red flag. And I would advise you to stay away from that individual and to, report this, report that situation, to report that individual to the local authorities or to whatever, hopefully to the SMP as well, but even to local authorities to actually, make sure that they get what they deserve. So going into it, hospice and home health, with the increase in COVID-19 patients, there's also been an increase in need for the elderly patients in our communities for home health and hospice services. Home health and hospice fraud can occur in several different forms. This can include things like false certification, so providing care to non-terminally ill beneficiaries for any level of hospice care. Again, high level of billing for unneeded services. Elderly patients and elderly people in general that I've dealt with in years past are some of the kindest folks that you can meet. And so, when you go into the community and meet some of these people, they're willing to do anything to get their, to get their conditions treated. So they're willing to give, their money for unneeded services, not knowing that, they really don't need those services, and that, on the contrary, some of these services aren't necessarily that expensive. And then they're also, again, billing for services not rendered, another big issue, across all different types of COVID-19 scams. Paying kickbacks for hospice referrals is another thing that we've seen. I'm not sure that we've seen this in Idaho as much as other states have experienced, but again, it's out there. The best way to prevent any suspected fraud regarding any home health or hospice fraud is really to research and ensure that the home health companies that you are working with are reputable. It's also important to make sure to double check the services offered and to double check the certification of the individuals providing care to patients. If someone's knocking on your door and you've never heard of the home health company, if you ask for their business card and then you're starting to look, online for information about their business and you can't find anything, that's a red flag. I'm not saying that the business is illegitimate, but again, obtaining all the information and then asking every question, making sure that you are getting the answers that you want is critical in order to prevent yourself from being a victim to this. So diagnostic testing. Testing, again, another big COVID-19 fraud issue. While fraud related to genetic testing continues to really be a big problem during the pandemic, the SMP has been receiving increases, in reports of telemarketers, emails, text messages, online offers, and door-to-door solicitations for coronavirus testing. They're both viral and antibody tests. As some of you know, there is a viral testing where viral tests can diagnose whether you have COVID-19. Antibody tests, on the other hand, can diagnose whether you had COVID-19. So you might not have it anymore. They do an antibody test and they can diagnose whether you actually had COVID-19, develop the antibodies, and then you probably don't have it anymore. Again, don't respond to any unsolicited offers. Contact your doctor or local health department regarding any testing that you're doing. Make sure that if you are going to be doing, if you get sick or if you or your loved ones, feel like you're sick, make sure that you go to, again, reputable places where they do COVID-19 testing. So your local pharmacy, contact your local health districts, make sure that they can give you information on where you can do proper COVID-19 diagnostic testing. There have been people that have even been known to try to legitimize themselves. When I say people, I primarily mean scammers, where they'll go out into a parking lot or somewhere that, a lot of people tend to, primarily seniors. They'll open up a tent with, different sorts of kits, different sorts of, medical grade equipment around them. They'll dress the part and then they'll conduct COVID-19 scams COVID-19 diagnostic testing and scam folks for their money. Last that I checked, places like CVS, I believe Walgreens, and a lot of other places are doing COVID-19 testing free of charge. I'm sure that you can contact a local health district in your area and they will be more than happy to direct you to a local clinic or a local pharmacy that does diagnostic testing free of charge. So again, make sure that you're asking all the questions that you need to ask and making sure that you're getting all the information that you need to ensure that the people that are doing the diagnostic testing for you are legit. So a couple ways that we can prevent COVID-19 fraud, and then Brad will also get into the more in-depth stuff on what to look for, in your MSNs and EOBs. So really, all of us use social media, and with the shutdown of the government and us not being able to go out into the public anymore, a lot of the outreach that we do, a lot of the contact, that we have with our relatives, with our friends, with our family, is through social media, places like Facebook, Twitter, Instagram, whatever other social media platform you can name. A lot of people have been using it because they can't go out and meet with their friends and family like they did pre-COVID-19. One way that scammers, really try to capitalize on gaining information from Medicare beneficiaries is actually looking at posts, looking at things that older individuals, primarily Medicare beneficiaries, post, and obtaining that information for later use to use against those Medicare beneficiaries. So be cautious when you're posting, information about your health diagnoses, your symptoms, anything related to your health. I know, when we post things on social media, a lot of it isn't ill-mannered, or, no one that's posting diagnostic information is posting it so that, they can give that out there. Sometimes we do it so that, our friends and family know of our health situations. But really be careful on who you're sending that to, and who your friends are, who's following you. Scammers can, if you have a public account, scammers can easily go and look at your previous posts. If you put something about your COVID-19 situation, if you are diagnosed with COVID-19, they'll obtain, your symptoms that you're writing out on a social media post, and then they'll knock on your door, they'll call you, they'll email you, they'll text you and say, hey, recently in your medical charts, we've noticed that you've increased in your cough, you have an increased fever, or some other bogus type symptoms, when they just simply obtain that information through your social media posts, and you might not even know. You might think it's definitely legit because they're actually, wow, like how else is someone supposed to know this information? Meanwhile, you're posting it on social media platforms for everyone to see. So really be careful what information you are posting, and if you are posting really private health information, make sure that at the very least that you're direct messaging the people that you want to inform about your health diagnosis or your current health situation. Again, text messaging and telemarketing has been huge. Scammers will obtain this information. They'll keep a track of all the information that you're writing. Some individuals out there that post publicly, they'll post their address, they'll post their city that they live in, they'll post their telephone number on Facebook. It's very easy to go in there, click on your About Me page, and obtain all that information. And scammers do exactly that. They'll keep a track of all the information about your health diagnosis, about your family, about where you live. They'll make a pretty well thought out story, and then they'll end up calling you, they'll end up emailing you, and then they'll give you a rundown, to say, hey, Mr. So-and-so that lives on this address, you think it's legitimate, and then you're more inclined to give them information. Again, really be careful on, if you are using social media platforms, not to give out a lot of personal information about your life, and especially about your healthcare diagnosis. One other thing that I should note that is on this slide is, the use of mailing and print. Again, if you are posting your physical home address, scammers, again, can obtain that information, and then what they'll do is they'll go to your home address and put flyers on a regular basis in your mailbox to legitimize their business. So let's say they're trying to sell you on some medical creams or tinctures or some sort of alternative treatment, right? They'll get your address, they'll get your information, they'll get their flyers, and then they'll go to your home, and then they'll put it in your mailbox. So you get this on a regular basis over 2-3 weeks, then they'll knock on your door. Subconsciously, you're thinking, hey, I've seen this business before, I've seen their logo before, this must be a legitimate business. And so what's going to happen? You might be more inclined to actually give them more information than you should about who you are, and more specifically about your healthcare diagnosis. So really be on the lookout for scammers trying to send out flyers or any type of ads, in order to legitimize their business. Again, you can never do enough research about, who's knocking at your door as a medical representative or salesman trying to sell you on COVID-19 cures and treatments or anything like that. So I'll let Brad take over from here, and Brad's really gonna show you guys what you guys should be looking for as far as how to read your MSNs and EOBs. So Brad, did you want to share your screen?
Should be up and running. Looks good. Thank you, Admir. Okay, so my name is Brad Talbot. I'm a a certified Medicare counselor with the state of Idaho. I work at the Idaho Department of Insurance, where we run a program called SHIBA. SHIBA is Idaho's source for free, unbiased Medicare information, counseling, and advocacy. So for any of you who are wringing your hands over open enrollment questions right at this moment, or if you have billing questions or anything else to do with Medicare, SHIBA is the source that you really want to take advantage of. We counsel about between 13 and 15,000 people a year. All here in Idaho. We have counselors in just about every corner of the state. So you can usually catch us anytime between 8 and 5, Monday through Friday, and find somebody locally or close by you to talk to you. Right now we're doing that all over the phone, so it doesn't really matter. But you can't find a local person to talk to about your Medicare questions. And that, so I want to talk to you today about a more specific way that you can really help prevent some of these overcharges and fraudulent charges to the Medicare system. If you don't know, Medicare, of course, is an enormous system, spends a lot of money every year. An enormous amount of that money goes to overcharges, improper charges, and strictly fraudulent costs. About $60 billion a year is what we lose in the system. And so the number one way that we can prevent or catch those ahead of time is for you to be vigilant. And I'm going to show you the tools that you can use to do that. Medicare makes it really simple. More simple than changing screens. There we go. Okay, so Medicare provides you with tools that you receive in the mail every quarter. It's either called a Medicare Summary notice or an explanation of benefits, depending on how you get your benefits. But the commonality is this phrase right here says, "This is not a bill." I always think that that phrase causes most of us to just disregard these. I don't have to pay anything, so I'm not going to bother trying to figure out what it says because it looks complicated. These are really important. Not only should you read and understand them, but we really want you to keep them someplace where you can access them at a later date, because they could be important if it turns out that you've been billed fraudulently, or there's a billing mistake, or maybe your insurance company isn't paying what you thought they should be paying. This is where you can go to really start to understand what should be happening versus what is happening. So when you look at these, we want to talk about just a few of the features of the Medicare Summary Notice. You can see that your name, a piece of your Medicare number, etc., that kind of information is here. You want to check that, make sure that you're getting the right one, and Medicare is talking to the right person. You can look at your deductible status and see who the providers are, the doctors who you've seen and who have billed Medicare in the most recent quarter. If you don't recognize one of those doctors, or you haven't seen one of those doctors in the last 3 months, that's a big red flag, and you should be on the phone to the doctor, your insurance company, or you can call us and we'll be glad to help you out with that question as well. So in addition, on the next page of these notices, it gives you directions on what to do if you have a problem, if you see a discrepancy somewhere, how to check this notice, how to report fraud, calling 1-800-MEDICARE, ADMIR at SMP, or the SHIBA office here at the Department of Insurance. We can help you with questions if you need help deciphering what these things are really meaning, or if you really think you have a problem, we all are glad to help you with those kind of things. An important piece of this is also the Medicare Summary Notice or explanation of benefits will tell you what has been billed, not only who's billing it, but what they're billing for. So you can see that on this date, on this EOB, someone has billed for a certain service and whether Medicare approved that service or not. If Medicare didn't approve, it will give an explanation, which is really important information if you're going to ask questions about why something wasn't covered and try to determine whether it should have been and whether you need to file an appeal or not. Okay, and in this case, this is also the Part A summary, which will tell you if you have any hospital bills in the last quarter. So if you look here and you see a hospital is billing Medicare for services and you haven't been to that facility or haven't been to it recently, that could be a big problem as well. Here you see what Part B, what your doctors may have charged and what you may owe. This is what you could be billed after Medicare pays its share of any bill. What's important to keep in mind is that this says what you may be billed. Remember, this is not a bill. We encourage you to wait until your insurance has paid, your Medicare or any Medicare supplement has paid a bill before you pay your share of any bill. So make sure you wait for the thing that says you do owe us, you've confirmed that it's a proper billing and that you do owe that amount and that you're making the payments to the right party. Also really useful, and most folks don't look on the back of these pages, but if you do have a denial, on the back of the sheets are directions on what to do if you want to appeal a denial of a claim. And you can get that started by filling this out right here. But you can also give us a call. We're glad to help with these appeals, and whether you just need some direction or if you need some help filling things out and getting the appeal started, we can help with those kinds of things as well. I don't think enough people take advantage of the appeal process. Frankly, more of you should. If you have questions about your billing or the amounts that you're being billed, it's a good idea to make use of the system. As this says, many appeals are successful and they help save the system quite a bit of money. I want to reiterate a few things that Admir said. It is really easy for fraudsters to bill Medicare for services and items that you don't need or never got if they have just a little bit of information about you, your Medicare number, a piece of your Medicare number, your address, your date of birth, and your name. That's about all they need. And way too many of you are not careful enough with that information, especially those Medicare numbers. You've all got new ones that are randomized. They used to be associated with your Social Security numbers and your date of birth. They no longer are, so that makes it a little harder for fraudsters to bill Medicare. But if they get that Medicare number, they really can go to town and start billing Medicare unrestricted until you notice it in those Medicare Summary notices. How do I know that y'all aren't careful enough with those Medicare with your Medicare numbers? But this fall during open enrollment, I've gotten a dozen calls. People who have left messages for me that they need some help and want me to call them back, and they've left their Medicare numbers in the message. Something you should never ever do. Don't give your Medicare number out to anyone unless you know the purpose and who you're giving it to, and trust that those are legitimate. Okay, so with that, again, you can always talk to SHIBA whether you just need help finding a new Medicare plan for the new year, or if you actually have problems with fraud or billing questions, you can always talk to us. Our contact information is here and at the end. So look forward to hearing from you. With that, I'll turn it back to Admir.
Perfect. Thanks, Brad. And I'll try to get this back going. So yeah, so my screen should be back. So like Brad said, if any of you that are experiencing any type of situations where you feel like you're getting unsolicited offers, where, you know, people are reaching out to you unexpectedly all of a sudden, and you know, really trying to, you know, sell you on services that you might not need or that you've never gotten before. And then, you know, it just seems way out of left field that they're all of a sudden contacting you now, or if they're, you know, consistently bombarding you and not, you know, leaving you alone. You really, you know, are more than welcome to contact any of our local areas. Right here, you know, you guys can see on screen, I've outlined the phone number for our local Idaho SMP teams. The cities that you see, they don't just necessarily serve those cities. That's where their offices are located. They serve, you know, the counties in and around those areas as well. For information on perhaps what county you do need to call, and which county, you know, which planning and service area you fall under, I'll go a slide back here. You guys are more than welcome to go on the Idaho Commission on Aging website. You know, we have a state map of what counties fall under which planning and service area, and then you're more than welcome to contact the Idaho SMP coordinator located in your area, and they'd be more than happy to, you know, walk you through your situation. You know, everyone contacts the SMP team for many different reasons regarding healthcare fraud. So if they might not be able to even answer your question, they do a great job of even, you know, working internally with the local area agencies on aging, and then other outside organizations on referring you to the appropriate entity in order to get, you know, what you need answered. Again, Brad's team over at SHIBA does a great job again of you know, answering any Medicare questions and healthcare and insurance questions. If you guys are unsure even whether, you know, whether to contact myself or Brad's team, you know, contact one of us and we'll work on, you know, getting you over to the right person in order to, you know, get your questions answered, and making sure that, you know, if you are a victim of fraud, or if your loved ones or anyone that you're working on, you know, on their behalf for, you know, make sure that you report it to one of us, and we can work together on making sure that, you know, we take the appropriate next steps. And so that's all that, you know, Brad and myself. If Bethany, if anyone has any questions, we'd be more than happy to answer.
Yeah, thank you so much, Brad and Admir. We did have one question which Brad answered, but Brad, I'm wondering if you wouldn't mind sharing it out loud too, just outside of the chat. So it came from Donna. She was commenting on how she never gets Medicare statements like the ones that were mentioned, only statements from her Medicare Advantage plan, and she was wondering why.
Absolutely. So Donna, you should be getting statements from your Advantage plan. The one that I showed, the Medicare Summary Notice, those go to people who have federal Medicare Parts A and B only. For you folks who have Medicare Advantage plans, you should be getting something that looks very similar. It just is titled an explanation of benefits, but the information provided should be very, very similar, including the explanations and the directions and the tips. And if you're not receiving those, you should give your insurance company a call and let them know that you're not getting them. You can always ask them for copies of previous EOBs, explanation of benefits, as well as the most current copies. And again, really encourage you not only to read and understand, but to keep copies of those in your files.
Thank you. Kathy was asking about the N95 masks, the NK N95 masks. She was asking if they're as protective as the N95 masks.
The NK N95?
Yes, NK95, if those are as effective as the N95.
You know, I wouldn't call myself a specialist on, you know, the laboratory use behind them. I know as far as, you know, surgical masks, cloth masks, or face shields specifically, that N95 masks are more protective than those. As far as the NK95, I wouldn't know enough about them to, you know, decipher what the difference is between those two. Thank you, Kathy. You've just given me a homework assignment that I will research and report back to the Scam Jam Alliance. But really, as far as fraud goes, you know, from the national network, I wouldn't say that we've heard much about N95 masks being sold, and that, people have been, falling victim to sales of fake NK95 masks. There might be some out there, but the N95 masks are the one that have been occurring on a repeated basis and in multiple states as well.
Thank you.
Yeah.
Looks like Danae just commented. She was saying that, in short, N95 masks are the US standards for respirator masks, and KN95 masks are the Chinese standards for masks. So, more you know. Well, thank you so much, Admir and Brad, and thank you to everyone.
Can I interrupt real quick? I just had a quick question for Brad, because that woman mentioned she didn't believe she had been receiving those benefits. Can people go online to see past EOBs from Medicare? Is there a way to do that, or does it vary based on your insurance company?
Thank you, Rochelle. Yeah, that's a great question. You can actually get these online. Thank you for that. By creating a Medicare account. You can go to mymedicare.gov or medicare.gov and create a Medicare account. And that would allow you to see these statements online in real time. They're created monthly online rather than having to wait for the quarterly statements to arrive in the mail. So great question. Thank you.
Yes, thank you both. We still have about 8 more minutes, so we can all stay on, I think, and see if there are any more questions. But feel free to all of our to our audience, if you all want to go ahead and drop off right now since the session is over. Just a reminder, next week we will be going over lotto and sweepstakes scams, and then also tax fraud. So that is very exciting for next week. And thank you all for coming today.